everyone, so this video is going to be my nursing video. Finally, I know a lot of people have been requesting this for like over a year and have been very tardy. I wrote down like some bullet points that I want to talk about because it's a lot to cover and I didn't want to make the video super long, and I wanted to make sure I hit like generally everything. So I'll just go ahead and get started. Okay, so if you're thinking about a career in nursing, the first thing you want to ask yourself is why. A lot of people think that they just want to do it because you can make like really good money in nursing, but I want to tell you right now that if that is your only reason for going into it, you're going to be very unhappy. It's a lot of really hard work. Physically, it's a challenging job, mentally, and you have to want to work with people. A lot of nursing is customer service, and I don't think people realize that. You still have to bring in business to the company so that it can survive and flourish and expand. So you want to make sure that customer service is something that you're okay with. You're okay with long hours. You're okay with physically a lot of work, a lot of like lifting and pulling and standing and walking, and a lot of bodily fluids, we'll say, because it's a dirty job. You not only do the nursing part of it, but you're gonna have to do everything that comes before the nursing. That means all of the washing, wiping, cleaning, blood, bodily secretions, organs, bones. It's a lot. You're exposed to a lot of different things, illnesses. So yeah, just be sure that you're okay with all of that. Okay, so now I just want to talk about prerequisites. So you've decided that this is what you want to do, and now you are figuring out what courses that you're going to need. So prerequisites are basically the courses that you need before you get to your actual nursing courses. With my program, the school that I went to, I was able to do all my prerequisites before I actually applied for the program. And I think that's really nice because it just makes your course load lighter. It kind of gives you a foundation that you know what you're going into, you know what you're kind of going to be studying. A lot of these prerequisites are general ed classes, your Englishes, your maths, obviously a lot of science. It's going to be anatomy and physiology and biology and chemistry and possibly microbiology and nutrition. So you want to make sure that you like those classes and you can do well in those classes, because the better you do well in your prerequisites, the better your chances are for getting into your program and school of choice. Okay, so when you're deciding what school or program that you want to go into, a lot of things are going to factor into that. I went to a community college. Community colleges are going to do a 2-year program, whereas a university or a college is going to have a 4-year program. The difference between the 2-year and the 4-year are the general college courses. So I already had an undergraduate degree, so I didn't want to go to a 4-year university, one, because it's going to be a ton more expensive. For the most part, a 2-year graduate in nursing, which is an associate's degree, and a 4-year graduate in nursing, which is a bachelor's of science in nursing, they generally make the same amount. Depends on the hospital, but new grads typically will make the same amount because neither one of them has any experience, regardless of 2 years versus 4 years of education. Neither one of them has any type of like professional experience. Now, when it comes to advancement, you're obviously going to have a bachelor's degree before you can go on to like a master's or nurse practitioner or CRNA, like a clinical nurse anesthetist, or teaching. You're going to have a bachelor's before you can move on to any of those jobs. So that basically is like the difference. And then the bachelor's program has a lot of like leadership classes that you generally may not take in an associate's degree program setting. But also another advantage to going to a community college is that there are tons of ADN, which is an associate's degree in nursing, to BSN programs, and there are a ton of ADN to MSN programs, which are your master's degrees in nursing. So a lot of those you can just do online, and you don't actually have to go to like a physical setting to do any type of like clinical work, because a lot of it is just going to be online coursework, which is beneficial because you can work and you can go to school at the same time. And a lot of jobs will do tuition reimbursement, so you can work and they will pay for your schooling as long as you continue to work for that company. So next I want to talk about money. That's a big thing. If you go to a 2-year university, it's a lot cheaper, obviously, than going to a 4 university. If you are a resident of the state that you're going to school in, it's going to be a lot cheaper than if you're paying for out-of-state tuition, obviously. I would highly suggest Googling, asking counselors, researching money that's out there. There are grants, there are scholarships, even student loans. Generally speaking, I don't mean private student loans, but there's a lot of money out there. A lot of places do tuition reimbursement. So also, if you already work in a medical setting as an assistant somewhere, as a secretary, as a certified nursing assistant, as an LPN, or anything like that, see if where you're working will pay for you to go back to school. So about textbooks, when I went to undergraduate, my first semester, I think I bought like, brand new books because I didn't know any better. And that's the dumbest thing that you can probably do if you don't have to do it. There's so many websites out there that sell used textbooks. Whatever your bookstore is, they have the used books and they have the brand new books. See if you can get the used books. There are also sometimes used bookstores on different campuses. Go to the library and see if you can get an edition that's like maybe a year before that. I'm mainly talking about your really big classes, like your biologies, your chemistries. Those books don't really differ too much from one edition to the other. You can also rent your textbooks, which is what I did in school, because you can rent them for an entire semester and they are much cheaper than even getting used textbooks. And then you also have the option to buy them eventually. So if you get to the end of the semester and you're like, I want to keep this book, you can buy it. They'll put whatever you have rented it for that whole semester, they'll put that towards whatever the price of the purchase is, and then you just pay the difference. That's very helpful because textbooks are very expensive. When you buy a brand new textbook for $300 or $400 and then you go to sell it back at the end of the year, they may give you $50 for that same book, but they're going to turn around and sell it for like $150. It is ridiculous. It is a huge moneymaker for businesses. So definitely see if you can invest in used and or rented textbooks. And also there are like e-textbooks. If you don't have a problem reading strictly from the computer, you can just download an electronic version of the book, and then you'll just have it, the entire year that you need it. All right, so study tips. Basically, you want to find out what type of learner you are. Are you a visual learner, an auditory learner, a kinesthetic learner, meaning that you actually you learn best when you're actually doing things? I am like a kinesthetic learner. I learn best when I'm actually doing things. Second to that, I learn better visually. I'm not just somebody who can kind of just read it and get it, or just listen to it and get it. I really need to be doing it. So figure out what your learning skills are. The way I learn best is repetition. So I would read first, read before you go to class, because it makes understanding everything in class a lot more simple. You're not sitting there like, what in the hell are they talking about? You already have a general idea. When I would read from the book or the PowerPoint printouts or whatever, print those out. If they offer PowerPoints, print 6 PowerPoint slides to 1 page. It saves you time, paper, and it saves you money. So just do 6 slides, handouts or whatever, on 1 page, and then read all of that. Read your book, read your handouts, your PowerPoint, whatever other links that they have before you go to class. So I like to highlight when I read, all right? And then I read the highlighted stuff and I make notes from that. So it kind of condenses it down, and then from that highlighted, the notes that I actually have, I just go over and over and over. I got to the point where I literally would walk in like circles, like really big circles, just around the perimeter of whatever room I was in, walking and just repeating stuff in my head over and over and over and over and over. Because the more you repeat stuff, the more you're going to actually transfer into your long-term memory, and it's not just going to be chilling in your short-term memory for like the duration of the test, and then you're done with the test and you don't remember anything. So yeah, also study groups are very helpful. You don't have to be best friends with everybody in class, but find people who have similar studying styles that you do, or even different studying styles. Like, we just like to get in groups and basically teach each other. We'll throw out a topic. Oh, let's talk about this. You say whatever it is that you remember about that topic. The next person can actually fill in holes from anything else that they can contribute, and you go around so that everybody just contributes everything. We also like to come up with like acronyms for things. It just makes things a lot more simple if you can find a sentence or a phrase that just, or a picture even, that just helps you to remember something. It's really helpful, and we quiz each other. Any like test questions that you come across, if they're at the end of the chapters, if you Google like NCLEX questions related to whatever subject that you're studying, if you test each other, it makes it really helpful. I know a lot of times we actually would get lucky, and some of the test questions that we had Googled or saw in the end of our textbooks, they actually ended up on the test, which are very, very helpful. Another thing for study tips is that where I went to school, we did a lot of select all that apply. Select all that apply are my least favorite question. They're the question that's going to say, hey, at least two of these questions are correct, possibly all of them. You have to figure out if there are only two, which two there are, or if there are only 3 or 4 or 5, which ones those are. And you can't get one of them wrong, you miss the entire question. There's no partial credit. So those you kind of have to just look at like true, false. You take each individual answer choice and you say, hey, is this true? Is this false? If some part of it does not apply, the entire thing is wrong. Do not choose that answer. If you can write on your test, write on your test. It's very helpful if you underline and circle like key components like all, most, never, always, some. These are words that a lot of times if you just skip over them, you'll get the answer wrong because you didn't see that it said most and not some, or it said all and never, or something like that. So if you can write on the test, definitely write on the test and highlight and circle and underline and double underline. All of that. So the NCLEX is the licensing exam that you take to actually get a license to practice. So once you graduate from whatever your program is or your school, you're not actually licensed to practice nursing. You take that test. It's anywhere from 75 to 265 questions. You don't know how many questions you're going to have ahead of time. Apparently, the way that it works is the more questions you get right, the harder the test gets. The more questions you get wrong, the easier the test is supposed to get, because it just wants to see whatever your baseline is. But you're going to think all the questions are hard. It is the hardest exam that I've ever taken in my entire life, and I don't mean to scare anybody, but I'm just being completely honest. I walked out of there feeling completely defeated, and I think that happens with majority of people. I recommend doing a review class. My school actually provided a review class for us. Typically they're like 3 days where you just do like really intense reviewing. They give you a book, you kind of hit the broad points of all topics, you do a bunch of questions, and then you might have like a test at the end of it. So school provided a review course for us. But there was also another review course that I took that I think was very beneficial, and more beneficial than what the school provided us, and I did the Hearst review, H-U-R-S-T. The Hearst review is 3 days from like 8 to 5. You get a booklet, which I wish I had it with me, but I don't have it here. A book that's about this thick. If I have a picture of it, I'll post it like right here. And it's heavily knowledge based. There are some review courses that are going to be heavily question based, and those are cool because you hit like, you're going to do like 1,000 questions, but you may not see those questions on the NCLEX. So you want to make sure you actually know the information. The Hearst review is a money back guarantee that if you do not pass on your first attempt of the NCLEX, you will get your money back if you did all the other guidelines that they have, okay? So the only thing I did, it came with like a bunch of like videos to watch online. The only thing I did was watch those videos and fill in the blanks in the book. Like we did in class, we filled in the blanks, and at the end they had like the same thing, and I just went over that for like 2.5 weeks. Generally, I would suggest taking the NCLEX roughly 2 weeks to 3 weeks, no longer than 1 month. Don't wait longer than a month to take the NCLEX. The longer you wait, the less likely you are to do really well on the test. There were some people that took it like a couple days after we graduated. I wasn't that confident. It's a up to 6 hour long test. So I think my test was about, I got like 120 questions, 130 questions. I think it took me like 2.5 hours. I was going very, very, very slow. And you don't know when the test is going to cut off. It just ends. You don't get a grade right then. There used to be a trick that you could do to figure out whether or not you had passed before the actual official scores, but I don't think they allow people to do it anymore. So you don't know, you are able to find out whether or not you passed for at least I think like 48 hours, and you can pay like $7 and find out whether you can get like your unofficial results or whatever. So the main thing is study. Don't like drive yourself into a wall. Take study breaks. Study for an hour, take a 10-minute break, and keep doing it like that. But I definitely would suggest studying like at least 6 hours a day for at least like a week and a half. Just repeating, and pick one study guide, one course that you're going to do, because if you try to do like 3 or 4, you're just going to confuse yourself. I'll also put some links to like other really good review books that I like in the description box. So take your time, eat breakfast if you eat breakfast, and just take your time when you're doing the test, okay? Take your time, breathe, it's gonna be okay. Okay, so after the NCLEX and you've passed, now you need to find a job. And that was the most difficult part for me. It took me like 3 months to find a job, because if you don't get into a new grad program, it's a little bit more difficult for a new grad to get a job because you don't have any experience, and you're like, how am I going to get experience if you don't give me experience? So definitely start applying to new grad programs in like February and March, because they fill up very quickly and they don't have a lot of slots. So as far as your cover letter, make sure it is geared to whatever specific job you're applying to. Don't do just like a general one where you just copy and paste it. Really talk to whatever organization or business that you're applying to. And then as far as your resume, as a new grad, you want to lead with whatever your clinical experience is, because you're not going to have any professional experience typically. So lead with your clinical experience. Any clinical sites that you have that are relevant to the job that you're applying to, list them. List any preceptorship or externship. You want to lead with education as a new grad. And as far as an interview, I thought that it was very helpful that I Googled questions and watched like YouTube videos on nursing interviews, because they're very different from any other job. I think I went on about 4 or 5 interviews before I got my first job, and each one of them are different. I interviewed at some psych hospitals, which were completely different from the ED interview, which was different from the long-term care interview. They're going to be geared differently. Some of them will give you scenarios. If this happens, what do you do? Some of them just want to talk about what you'll be doing. Some of them want to know the general stuff, like why do you want to work here? What are your weaknesses and your strengths, and what was your clinical experience like? Write your answers down. Study them so that you're not just sitting in the interview when they ask you a question like, already kind of have a general answer that you can just kind of expand on. Be confident, smile, try to have fun, tell these people what they want to hear. Let's be real. You want a job, they're looking for an employee. Tell them what they want to hear while still being honest with yourself. And then lastly, I just want to talk about some pros and cons. There's like a million different kinds of nursing that you can go into. You just kind of have to have your niche. I never thought I wanted to go into the emergency room just because I never thought of it. I just always was like, oh, I'm going to do L&D nursing, maternity, labor and delivery. I love that, right? So I wound up in the ER. I love the ER because as a new grad, I thought that it was an excellent way for me to use my skills, because a lot of things you don't get to do in school and you don't do them for the first time until you're actually working. And I get to use a lot of my skills. We do a lot of IVs, a lot of like EKGs. We do a lot of like ortho stuff like casts, and we do a lot of wound care. We do a lot of respiratory care. It's a ton of stuff. You're gonna see every single thing because every single complaint comes through the ER. You're gonna see people that aren't gonna make it. You're gonna see people that are traumas. Like they are train wrecks pretty much. You're gonna see anywhere from a week-old baby to 102 years old and everything in between. You're gonna get all types of, obviously, ethnicities. In general, you're gonna get people from all over the place because guess what? They were visiting a friend or they were driving on the interstate and this happened and now they're in your ER. So that's what I like. The pros are that I get to deal with all types of people. I get to see pretty much everything. I get to use a lot of my skills that keep me fresh and keep me competent. And also it's go, go, go. So generally in nursing, you don't have like the same day, any 2 days anyway, but in the ER, you definitely don't have 2 of the same days. You don't even have 2 of the same hours for the most part. The ER that I work at sees a lot of overdose, a lot of psychiatric patients, a lot of geriatric patients, a lot of people just kind of like off the street. Like I said in my vlog, like the trauma center is down the street from me. So if they're like a critical EMS, they're not gonna come to my hospital, but you still get people that walk in that are critical. The other pros are that obviously you're pretty independent working in the ER. A lot of times you're gonna see the patient before the doctor's gonna see them. So sometimes you have to make clinical decisions. We have what we call standing orders, which basically give us the freedom to put in actual orders that anywhere else would be considered like doctor's privileges only. So sometimes we can order medications, we can order tests if they're under this umbrella of symptoms or whatever for this one, you know, patient. We can go ahead and get that stuff started so that by the time the doctor gets to them, we're already getting results back, and care can move a lot faster because they want care to move a lot faster because they have to see a lot of patients and we have to implement a lot of interventions. Some of the cons for working in the ER, generally in nursing, you don't get a lot of downtime anyway, but in the ER, it's very, very go, 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 go. At my old job, I pretty much never got a break. You work 12 hours and you're allotted a 30-minute lunch and maybe 2 15-minute breaks. I would be lucky if I could like eat my food in 10 minutes, and that's no lie. That was pretty much every shift. You might have a shift where it's a little bit slower and you're like, hey, can you cover my patients? I'm gonna go chow down on some food. But for the most part, it's like eat as fast as you can and when you can, and use the restroom when you can, because there's not a lot of like just downtime. Also, you're working really long hours. So I work 3 12-hour shifts. I work 7 p.m. to 7 a.m. also 3 p.m. to 3 a.m. And so sometimes you're tired when you get off because you're on your feet a lot and you don't always get off at the end of that 12-hour shift. Sometimes you're there till much later depending on your patients or who you're reporting off to, their patient load and such. So yeah, sometimes you're there a lot longer. You also, most hospital settings are going to require you to work some weekends and some holidays. So sometimes you have to make sacrifices. You don't always get to plan everything with your friends or your family, and that kind of sucks that you don't always get holidays and weekends off. Also, obviously, dealing with difficult patients, and I don't mean difficult as in critical patients. That sometimes is challenging too, obviously, but I mean people who are upset. The average wait time in America in an emergency room is like 4 or 5 hours, and I don't think people understand that. The ER that I work in has 25 beds. There are like 2 trauma rooms. There are like 25 beds. There also is a psych side of the ER also for our psych patients. But people need to understand that there may be 25 beds, but there aren't 25 doctors. There are about, at peak hours, there are about 4 doctors. There are about 6 or 7 for mid-levels, which is going to be like your physician's assistant or your nurse practitioner. And then there are about maybe 20 nurses working. We're obviously going to see the most critical patients first, but everybody thinks that they're the most critical. So sometimes, you know, a lot of times nursing is a lot of customer service. It's a lot of apologizing, explaining that we're going to get to you as soon as we can, that we are giving you the best care that we can. Just because you may see me sitting at a computer does not mean I'm not working. A lot of nursing is charting, and that's the other part that people don't understand, is that legally I have to, let's see here, CYA, which means cover your, exactly. I have to leave a paper trail. Everything leaves a paper trail. There has to be an order for every single thing. There has to be a reason why we ordered every single thing. And I have to document that I did it. If I don't document that I did it, it didn't get done. And if we get audited, that's a big no-no. So a lot of nursing is documentation, and it's very anal. It's like to the T. So sometimes you don't get a chance to document in the moment, and you have to do it later, which means you might have to stay later. You might have to just try to do it all the time while you're juggling all these other things. Just understand that we are getting to you as soon as we can. Please be nice to your nurses, okay? We decide when you get your pain meds. I think that's everything I have. If I missed anything, ask me down below and I will try to get back to you as quickly as possible. And I apologize for this video being so late, but thank you guys for watching. Follow me on my social medias, subscribe please, so you'll be notified when I update. And yeah, thumbs this video up if you like these type of videos, if you want me to do more, and I will see you guys in the next video. Bye. Be the death of me, at least we'll both be now, and she'll always